traffic flow. So we've talked a little bit about the separate, there's the boulevard wrought iron fence here. How did you decide traffic flow? Because they are kind of separated. There's medical services on one side and a lot of the ancillary services on the other, and they're kept apart by this wrought iron fence.
Right.
How did you envision the traffic flow moving here?
Well, one of the reasons, just as you described, we felt that we needed to separate ancillary services from the medical care because we may have different business hours. And there may be times when some of the services are not open and the clinic may be, or vice versa. And so we needed to be able to separate the two just from a pure business perspective. We also felt that a lot of times you're going to have several pets going into the services side for daycare, for grooming and so forth. And we don't necessarily want old hat traffic right in front of the exam rooms and dogs barking and doing all those things and creating disturbances and things. So we wanted this to try to physically separate that traffic flow so it worked well. We only have one door in and out of the exam rooms, and we chose to go just one door versus two. One, to save some space, because all we're paying is for a hallway, and we figured that wasn't, from a business perspective, not necessarily the right thing. And two, we felt it was more efficient to get folks coming in and out one door. But one of the issues we have ran into is when you have a back hallway, sometimes staff tends to congregate back there and you get all sorts of secondary conversations going on that you can hear from the exam rooms, sometimes that are not necessarily appropriate for what's going on. We thought, we don't want to deal with that. We don't want to have to police that, we don't have to change that. And honestly, we feel that this could be convenient for us to come in and out of the same door, and clients, they don't look at it like, what's behind the other door? They've seen everything. And we wanted to make this very open so they can see everything, and it's not like, oh, they're going to a secret place back there. No, you're seeing exactly what's going on.
Well, we can talk a little bit about that. It's actually, I'm surprised by how many doors are open here. The doors that are closed are ones where there are puppy daycare, where there's puppy training, you know, the underwater treadmill door will be closed, exam rooms are closed when there's patients in there. But I can see straight back into the staff break room.
Yeah.
Now, I don't think, 99% of veterinary practices, there is no sight line to the staff break room, and the door is certainly closed.
Yep.
And treatment area, also, you turn around as long as there's nothing, you know, extreme happening. When there's nothing extreme happening in the treatment area, the door's open there too. The place feels, what's the philosophy behind keeping all these doors open?
And it was just basically, we're not trying to hide anything. I think, and we've had comments with our other clinic in the past that people aren't sure what happens in the back. And that's one of the things we wanted to get around, is that we're going to be very open about it. In fact, we do a lot of the things in the exam rooms with the owners when we can, with nail trims and blood draws.
Is that new?
And that's fairly new for us. We thought, you know, there's some pets that it may not be appropriate, and some owners that just don't want to see needles, and so we honor those requests. But where we can, we try to do more of that in the exam room from the owners so they can see exactly what's going on and that we're not trying to hide anything. And that gives the owners better confidence that, hey, these guys are really trying to do the best for my pet, they're really trying to take care of things, and they're not trying to hide anything. And we think that's a very positive thing that can come out of it. So we said, we want this to be an open environment. We have windows in front of daycare, in front of grooming and so forth. Yes, you can, if you go back, and we encourage people to walk back and look at our daycare facility, and if they turn around, they can see back into the treatment area.
Right.
And we want them to be able to do that. We're not trying to hide anything. We're trying to do the best we can for their pets, and that helps reinforce that sense and that feeling, and it gives people confidence.
Do you think any of the open transparency helps lower stress for the pets and or the owners?
I think so. I think it does. And it's amazing because a lot of the dogs will come in and they're looking around at everything that's going on. They get into the exam room and they go, uh-oh, this is what I'm used to. You know, this is the exam room again. Right. And what we've done with some of those dogs, if we walk them out into the hallway, or we take them even down to daycare, and we've been able to do some things, trim some nails, give some injections to pets, because now they're stimulated by other things, and they're out of that square box that they've been used to all their life. And so this open environment has helped us address some of those anxiety needs in some pets. Doesn't work for all of them, but it works for some of them, and it gives us another thing in our toolbox to try to be a fear-free practice.
Toolbox, I think that's one of your technicians yesterday in the interview talked about this toolbox of low stress techniques that they can use to employ on patients individually. I mean, you mentioned you could go do a nail trim in that area, you could do a nail trim in the treatment area, you could do a nail trim in the exam room. Sometimes they ask, make sure an owner stays. Sometimes occasionally they'll ask, would you be more comfortable leaving the exam room? So we do this, maybe it calms the patient down. What is does it feel, how individualized is treatment based on trying to keep stress levels down here?
Oh, it's got to be individualized. You've got to work with pets because just like people, not everything is important to them or they appreciate or they like. Yeah. And you've got to start to understand about the owner and the pet. We all know when we deal with owners, and if we see the owner enough times, we get a pretty good sense of how we need to communicate with them. Well, you get the same sense with pets too. If you pay attention to it, you know the right way to start communicating with dogs or cats so that you can do some of these things. And so you do have to individualize it. And it does take a little bit of work, a little bit of time. But when you do that, it speeds things up.